Assalamu alaikum. Today the topic of my lecture is Alzheimer's disease. It is the most common cause of dementia in elderly and it is a neurodegenerative disease. The risk factors that cause Alzheimer's are age, female sex, history of head trauma, Down syndrome that is trisomy 21 and genetics. If it's early onset Alzheimer's, it's autosomal dominant inheritance, and if it's late onset Alzheimer's, it's polygenic inheritance. The neurotransmitters involved are acetylcholine, serotonin, and norepinephrine. All of them are reduced, but the most important neurotransmitter involved in Alzheimer's disease is acetylcholine. Now discussing the morphology, we have gross morphology and microscopic morphology. Grossly, we see diffuse cortical neuronal atrophy and enlarged ventricles, while microscopically we see accumulation of senile neuritic plaques called beta amyloid and formation of neurofibrillary tangles called tau proteins. Clinical features are that gradual onset of dementia, anterograde amnesia, which is inability to remember new information, anosognosia, which means that a person is unaware of their illness, aphasia, which is language deficit, apraxia, which is inability to perform skilled movements, agnosia, which is impaired ability to recognize objects despite intact sensory function, disturbance in executive functioning, that is planning and organizing, some psychiatric manifestations such as depression, agitation, psychosis, personality changes, aggression, and sleep disturbances. Now we'll discuss the drugs for the treatment of Alzheimer's disease, but for their better understanding, I would like to explain the acetylcholine synthesis first. Choline that is placed extracellularly moves intracellularly, and in the presence of acetyl-CoA, it converts to acetylcholine. In the presence of choline, acetyltransferase enzyme. This acetylcholine now goes into the vesicles, and a hydrogen ion moves out in exchange to this acetylcholine, and this acetylcholine is stored into the vesicles. Now when the excitatory potential comes, it activates the voltage gated calcium channels, and calcium moves intracellularly, and this calcium causes the vesicle to fuse with the presynaptic receptor. Now the acetylcholine released into the neuronal cleft, it either attaches to the postsynaptic receptor or it goes to the presynaptic receptor, where it helps in the regulation of more acetylcholine release into the neuronal cleft. And the acetylcholine that attaches to the postsynaptic cleft, it causes next intracellular response in next neuron. The acetylcholine that is present in this neuronal cleft, it is broken down in presence of acetylcholinesterase to choline and acetate. This choline goes back, adding to the pool of the choline, and again the process of the acetylcholine synthesis is repeated. After understanding how the acetylcholine is synthesized, now we'll move on to the drugs. The first drug used in the treatment of Alzheimer's disease is cholinesterase inhibitors. Their mechanism of action is that they work by inhibiting acetylcholinesterase, thereby increasing acetylcholine in the synaptic cleft. How the cholinesterase inhibitors work are that they inhibit the acetylcholinesterase, thus more of the acetylcholine is present in the neuronal cleft and more attached to the postsynaptic receptor. Now the drugs included are donepezil, rivastigmine, galantamine. The adverse effects are nausea, vomiting, diarrhea, bradycardia, lack of appetite, weight loss, tremors, anorexia, and muscle cramps known as myalgia. The next class of drugs is NMDA receptors antagonists. Their mechanism of action is that they block NMDA receptor, thus limiting calcium influx into the neuron. Now you guys must be thinking that the calcium influx is needed for the acetylcholine vesicles to fuse into the presynaptic receptor, thus releasing into the neuronal cleft. But normally we need a specific amount of calcium that stimulates the release of acetylcholine from the vesicles. But if excessive intracellular calcium activates the acetylcholine, a number of processes are activated that ultimately damage the neurons and lead to apoptosis. So as in Alzheimer's disease, we have beta amyloid proteins which accumulate, and accumulation of these proteins lead to high amount of glutamate. So when we have more amount of glutamate, more of the NMD receptors are activated, more of the voltage gated calcium channels are activated, and more calcium influx, thus stimulating large amount of acetylcholine, and thus the process gets overactivated and leads to the rupture of the cell. So in order to prevent this cell rupture and apoptosis, NMDA receptor antagonists are given. The drug included in this class is memantine. The adverse effects are diarrhea, headache, insomnia, agitation, restlessness, confusion. Thank you so much. This was all for the topic of Alzheimer's disease. Stay tuned for more lectures.